Hello, my name is Mira Bihari. I am a pediatrician and adolescent medicine specialist. I started adolescent medicine consulting to help more people learn about the subspecialty of adolescent medicine and what adolescent medicine specialists do. If you've been following along with these videos, you know that we've been talking about stress. Today, in honor of Martin Luther King Jr. Day, I wanted to talk about discrimination. Being discriminated against is stressful, to say the least. In this brief video, I want to talk about what we currently know about discrimination and its effects on health. To start off with, I want to point out that there is a diagnostic code for discrimination and racism. It's Z60.5. It falls under the codes for factors influencing health status and contact with health services. As many of you know, Z codes don't lead to increased reimbursement, but they can help provide a more complete picture of a patient's health risks. As you can see, the code is intended to be used for patients who are experiencing persecution or discrimination, perceived or real, on the basis of membership of some group, as defined by skin color, religion, ethnic origin, etc., rather than personal characteristics. There is another code, Z60.4, for use for patients who are experiencing exclusion on the basis of personal characteristics such as physical appearance, illness, or behavior. Think Mean Girls. Why is this important? Well, we all know that people who experience racism or exclusion have increased signs and symptoms of health problems, including inflammation and specific illnesses such as childhood asthma, hypertension, substance use and abuse, diabetes, obesity, anxiety, depression, and maternal and infant mortality and morbidity. For more information, check out the resource below from the APA that goes into some more details about the articles that describe these health risks. There are many factors influencing why patients have these risks, from structural racism to inequalities with accessing services to limitations of healthcare providers and how we interact with the patients. Lots of work to be done. So you might be thinking, this is overwhelming. Knowing that there are all these health risks, you might think, hey, we probably have a well developed plan on how to handle these issues and address them in an office visit, right? Well, to my knowledge, there is no handbook of addressing racism in a visit. If you know of such a handbook or these guidelines, please let me know. I would love to talk about them and share them with others. I can tell you what I've done in office visits. One, I acknowledge that it's a problem. I identify the health risks and the relationship of those risk factors to the other health issues that are going on and some of the inequalities that are out there. So, lack of access to quality produce, lack of access to a high quality education, lack of safe spaces for physical activity, and more. Yes, this is a systemic problem, and we would love to be able to change it overnight, but we've got to deal with what we have and find ways that we can help the patient in the current environment now. We also want to discuss any health concerns that you know are related to stress or race. Schedule additional time for it if you can. Make some follow up visits and be mindful when you're making these follow up visits that the patient and their family probably need to limit missed time from work or school. You also want to identify any safe spaces in the community so you can help connect the patient who might not be connected to a larger community and more supports. If these spaces do not exist in your environment, consider making them. Perhaps having a support group in your clinic or some after school space to help the patients and their families learn some healthy habits like cooking classes or videos that might help them learn some different resources that they could watch on their own time. When you see racist policies and practices, call them out. Help the patient advocate for their health needs. From personal experience, I have seen one patient who was from the majority background get a warning, and another student who was from a minority background get suspended from school for the same offense. There were definitely racist factors at play for this. We want to call those out as much as possible and help the patient advocate for what they need and the help and support that they deserve. We also should admit our limitations and the limitations of the healthcare system in addressing all of these issues. We all wish we could have a fair system right now, but we don't. We can keep working towards it, and hopefully your patient will be comforted by the fact that they know that somebody else cares and knows that this is something we need to change. Also, keep learning. There is more and more research coming out about the health effects of racism and how we can change this. Stay up to date on the information that's coming out. Ask your local healthcare institutions what they are doing to help address and change the discrepancies in healthcare. Thank you for tuning in and listening to my thoughts on discrimination and all health issues that affect teens, tweens, and young adults. If you'd like CME credit for this video, please follow the instructions on the link for reflection credits from CMFI. For more ways that you can help the teens in your practice, including some custom educational experiences, please visit our website, www.adolescentmedicineconsulting.com. Thank you for your time and attention and for all that you do to help teens.